Hi everyone, Carl Rosen here from the lovely Anchorage, Alaska. I'm an oculoplastic surgeon, neuro-ophthalmologist, fellowship trained. My friend and compadre, who is not in Alaska, is John.
Yeah, nothing against Alaska, but I've never been there. I want to visit. So I'm John Ditkoff. I am a general ophthalmologist specializing in cornea. Carl and I met each other when we did our residency training at Einstein, hence Einstein's Eyes. And Carl came up with the idea of this channel. We've been having a good time, having some fun getting out, getting to talk about a bunch of different topics. So tonight, we're going to talk about my specialty, which is dry eye as a cornea specialist. And I invited one of my patients, Michael DeBlis, who is an attorney, but also is involved in ice hockey and has a lot of other cool hobbies that he'll talk about. And what I really thought would be a good idea, and Carl agreed, was that we'd invite him to hear a perspective on how dry eye was impacting his life, and then what he's done to improve that part of his life. So take it away, Michael. Tell us about your experience.
Thank you, Dr. Ditkoff. Thank you, Dr. Rosen. Boy, it has been a journey for me with my dry eye. It started when I was a teenager, actually, in my late teens. And I didn't realize what was going on at the time because I was an ice hockey player. But I realized whenever I was on the ice in a very dry atmosphere, my eyes would get blurry. And it was this phenomenon where it was often difficult, to see the puck, and that definitely impacted my performance as a player. And over the years, I got involved in ice hockey refereeing, and I was always a very good skater. I loved to do the high levels like high school and college hockey. But I really began to see a drastic fall in my vision in my early to mid 20s, and that impacted my ability to referee the high levels. And so I walked into Dr. Ditkoff's office probably at the age of 25, 26, and I didn't really know what was plaguing me at the time, but you, Dr. Ditkoff, did a comprehensive examination and determined that I had a dry eye symptom. And initially I said, oh, well, that's, how could that be wreaking havoc with my extracurricular activities? But it all began to make sense when you sat down and explained it to me that there wasn't enough moisture in my eyes to keep them saturated. And that was why I was going through all of the eye drops. Like before you diagnosed me, I would go through easily 2 vials a day of the eye drops to keep them moist. And when I saw you, you had some thoughts about how we could approach this. I think we tried Restasis, if I recall, Dr.
Right.
Dick.
Yeah.
Didn't really see much improvement from there. And then you introduced me to this idea of plugs. And when I heard of a plug, the first thing I was thinking of is like, a plug for a sink. And I said, well, what does that mean? What are you talking about? But you explained to me what it does and how we're going to try to keep as much moisture in the eye as possible. And I think the first set of plugs that you had me try, I saw an improvement immediately. I would say within the first 48 hours. Those plugs, however, kept so much moisture in my eye that I was tearing up all the time, and people thought that I was crying. So I was delighted to have a moist eye and to be able to see so clearly for the first time in years. But I also realized that these version of the plugs might be a little bit too much for me. And so through trial and error, you recommended another, I think it was kind of like on the cusp of some new technology where they dissolve, and there were uppers and lowers, and you started me on them, and wow, it was the same type of improvement with the initial set of plugs, but without all the tears and the constant having to dry my eyelid up with a tissue.
Yeah. So a couple of things I would expand on for anyone watching. Number one, there's many different treatments for dry eyes. We even have some videos out about it. We usually start, just as Michael said, with lubricating drops. I like to get a sense of how the person's responding. So the fact that he used the drops already before he came to the office and he knew it helped him kind of pointed me in the direction of dry eye. And I think, I mean, you might not recall, but I think you probably had other symptoms other than blurred vision. I mean, including tearing, scratchy, burny, whatever you were having, but it's hard to remember probably. And then you're right, the first plugs I put in, we did bottom and top, which were dissolvable plugs, but they only lasted a week. And you were amazed. I mean, you were like, wow, like my symptoms just went away. Yeah. Then we were doing Oasis plugs. There's many different types of plugs. Those are plugs that theoretically we did bottom and we could do top as well. And they would be long lasting. They don't dissolve and they could solve the problem. But you're right. For some reason, those plugs were too much for you. But the other problem you had, and I remember, that's why I thought of inviting you, is you were so sensitive. It was Michael would know if a plug fell out. Like he could tell within days that one plug fell out of, let's say, the right eye, and he would come in saying, my right eye doesn't feel right. And I'd look and, lo and behold, the plug was missing and I'd pop a new one in. And that seemed to be happening with some irregular frequency enough that it was annoying for him. Like, he's a busy guy, he's an attorney, he's got a lot of hobbies. He's got to go out of his way to get an appointment and come in for a plug to be replaced. So ultimately, that's why I went to the 6-month plug. The idea was that these plugs go all the way in. They can't fall out. So he didn't have to worry about it. I didn't have to worry about it. And what we do now is we alternate, but we do bottoms and tops 6 months. So we know they dissolve in 6 months. So pretty much every 6 months, I know I've got to replenish those plugs. But he doesn't have to worry about it anymore. He gets that consistent treatment for his dry eye, along with using drops. So, I mean, how often do you use the tears?
I would say maybe once every 2 to 3 weeks.
Wow, that's great. I didn't even realize you were able, because most of my patients still use the drops to some extent because they've still got to lubricate the eye. But for you, the plugs are really beneficial. So yeah, and that's a great, I mean, you really did a great job of explaining what I was hoping our listeners could listen to, because a lot of people out there, they go from doctor to doctor with symptoms like yours without a diagnosis, or they're being treated with things like Restasis, Xiidra, artificial tears, without even discussing plugs. And we have a whole video about plugs, but I think plugs really work about 95% of the time without significant side effects, covered by insurance. I mean, pretty simple, easy stuff. Carl, do you have a practice in Alaska where, like, anyone in your practice doing plugs regularly, a cornea guy or anything like that?
Yeah, I mean, we have cornea, glaucoma, general ophthalmology, and they do use plugs. I don't keep track of it. I mean, I suppose I could dig up that data. I see them for if the lacrimal system is obstructed, and
Right.
I'll irrigate, I'll tighten the lateral canthal tendon to enhance the pump function. I'll open up the plug if it's too small or if it's stenotic. And for some folks, and we did that video, John,
Yeah.
where we had vital tears on where we use autologous serum. Autologous serum, when all else fails, really is a great tool in your tool belt,
Yeah, I find, I mean, when it comes to dry eye, like Michael said, we kind of go through exactly what he said. It's really kind of trial and error, and each patient is very unique. I mean, I have some patients, including my wife, I did plugs, they didn't work. And ultimately, she's done great on Xiidra, which is like Restasis.
Yeah.
I think she has more of an inflammatory issue than tear abnormality or insufficient tear flow.
Right. There's
But
also
Michael, I mean, did it affect you at work, you think? I mean, in terms of reading, computer, or not so much?
I would say, yeah, it has. It has. Before we discovered the plugs, there was some difficulty with reading. Sometimes it would be necessary for me to squint when I would be in front of a laptop or computer. I also got a lot of red and irritation. So I couldn't really stay in front of a computer screen longer than 20, 25 minutes at a time. So there's good and bad that came from the plugs. With the plugs, because I basically regained what I had been missing for so long, I went back to my old tendencies. And, of course, I'm sure that's impacted, my vision in many ways. So, through working with you, you've encouraged me to try not to stay in front of the computer as long as I am
That's
used to
nice.
doing, and to rest my eyes a little bit, or look at some point out in the distance in order to keep the eye, from focusing on one area for too long a period of time.
Well, it's interesting because one of the most common, so when I see a patient, a lot of times in their history, as Carl knows, history is really important. So if someone comes in and they say, I can't see the computer, typically then it means they either have eye disease or they need new glasses. But that's not the common complaint I hear. The common complaint I hear is I'm on my computer and after maybe 15, 20 minutes, everything starts to get blurry. And then those are people that typically have dry eye or some type of tear abnormality, I should say. And that's how we start. We start with one option, then another option, and it's really trial and error to figure out which technique gives them the best result. That was great. I mean,
Yes.
Carl, you have any other questions?
Yeah, I do have one. So Michael, if you could label the most significant symptom during your experience, what would it be?
I would have to say, and it still happens, but not to the extent it did before I began the plugs. It's the halo effect when you're driving at night, and all the car lights and all the street lights are so blurry that you just want to scream. You just want, you want that feeling of, after you douse your eye with, with the lubricating drops all the time. But as I said, it's not 100% fix, but the improvement is stark. And now I don't have that halo effect to the same extent that I did before I began the plugs.
Yeah, I'm glad you mentioned that because that's a very common scenario. I try to explain to my patients what I hear from many people is either on the computer, driving at night, or reading a book. Those are the three things that seem to bring out dry eye the most. Other than, obviously skating on an ice hockey rink can do it, but the reason those three activities do it is because when people are focused on something, like driving at night, they tend to be a little bit more focused, a little more concentrated. They tend to blink less. And once they start to blink less, their eye dries out more. And that happens when you're on a computer and you're intense and you're reading a document. You almost blink less involuntarily. So I even tell people sometimes, if you start to feel yourself getting halos or blurred vision, blink. Because if you blink, that's going to lubricate your eye to some extent. But obviously, you're not going to want to have to think about it. So it's better to treat the underlying condition.
Yeah. It's interesting you mentioned blinking, Dr. Ditkoff, because I'm told a lot by people I don't blink a lot, and I think probably that was a function of all the reading that we have to do in law school, as I'm sure you're aware, because I know you had to go through it yourself in medical school. But yeah, so you develop habits, and that's one of the things that I really try to remind myself to do a little bit more frequently. And it's amazing if I do, if I focus and put some conscious attention on blinking just randomly, it does keep the eyeball moist, and it does, it does help, I think, in lubricating.
It definitely sounds silly to people, but it's when you think about those activities. Think about the last time you were driving at night, it's dark, it's raining. The last thing you want to do, you try not to blink because you're so focused and so concentrated on the road. And that's when the dry eye gets worse.
Yes. Dr. Ditkoff, can I just mention about the procedure for putting them in
Oh,
and my
yeah.
experience with that? Because to me, it's very straightforward procedure. And I guess if I were to describe it in layperson's terms, it's, I'm sitting in a chair and you come right up to me, and you have those glasses on, and with an instrument, you've got it, I guess, on the tip of your instrument, the plug, and then you basically tell me to just look straight out at a point, and then you put them in, and I don't feel a thing. It takes less than a second to put in, and it's, as I said, after they're inserted, I can tell a difference right away. So it's painless. You don't feel a thing, and it's just an in-office procedure.
Yeah, a lot of patients ask me, am I going to use numbing medication or lidocaine we really don't need to do anything. We just pop them in. It's basically putting a little plug in a hole.
Fantastic.
So having these plugs has really changed my life, and
Yeah, I
you know,
appreciate it. That's great.
I can't thank you enough, Dr. Ditkoff, because I had been to other doctors before. I consulted with you, and like you said, I mean, we were just kind of like I was just randomly, going around, and nobody could give me a diagnosis. And it was really concerning because I was, like I said, very young at the time that these symptoms manifested themselves. So I'm thankful to you, and at the same time, I've learned from from my from having you as my doctor that I also have to take better care of myself when it comes to my eyes. And so I feel like it's a 50-50 proposition between the plugs and at the same time making sure that I'm not overusing my eyes.
And Michael also had, I told him we have a video about floaters, right? Michael, did you get to watch it?
I did, yes.
Yeah.
Very helpful.
That's great.
So you were great. I really appreciate your time.
Yeah, no,
and,
thank you. Thank you, Michael, for coming on. So we're going to
My
wrap
pleasure.
this up. And yeah, so thanks, everyone. Please subscribe, and we'll see you on the next one.